All right, good evening, everybody. I'm Robert Carter, and I'm the chairman of the Coffee County Opioid Abatement Committee. This is the June 25th meeting. The members, we have a quorum present. I'll call the meeting to order, and if the members present would identify themselves.
Lee Nettles.
Leslie Brassfield.
All right,
Coffee County Mayor Dennis Hunt.
very good. And we've received some information. Dr. Keel's going to be out of town, and Roseanne called. She might be a little bit late. But anyway, we do have a quorum. Before we get started, I'll make a motion to approve the agenda from our April the 17th meeting, April the 18th meeting.
I'll second that.
Very good. And I will invite any public commentary. Let me get everybody up to speed.
You would please vote to approve, please take a
Yeah,
vote
let's,
for the minutes approved.
I move to approve the minutes. Do I have a second?
I seconded it.
Motion?
I say aye.
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 Okay, motion carries. We've approved the minutes. To get everybody up to speed, back in April, we met, a pretty important meeting. Obviously, the state of Tennessee has authorized a fair amount of money in what they call the Opioid Abatement Committee, Opioid Abatement Funds. What that is obviously the United States and the various states sued the drug manufacturers, and as part of the settlement, a lot of money has been paid out by pharmaceutical companies, and it's been dispersed to the states. And Coffee County was authorized a certain amount of money. And some of these are one-time grants, and some of these are recurring grants. But what we did in the April meeting is this actually takes us back into March and February. We solicited invitations for people that had organizations that we thought could use the money, charitable organizations could use the money. And so we had several institutions and organizations that came up here, and they made their presentations, and we voted on it, and we dispersed the money appropriately. So what we've done here today is we've set it out 2 months. Is we want to hear from some of the people that we've dispersed the money to, and see what they've done with the money. We are charged with oversight on how the money is spent, and obviously we wouldn't have authorized these the disbursement of these funds if we didn't think they were going to be spent on proper purpose. But we still kind of have to maintain some oversight, and that's really the purpose of the meeting today. And I'll invite public comment now. This is on the agenda where I'm supposed to ask. Does anybody have anything they want to add? All right. So, again, pulling everybody up to speed, the money that was authorized at the last meeting of the money that we authorized disbursement of went to 4 entities. Coffee County Collaborative Coalition, we authorized the disbursement of $33,375 on the 15th of April through the end of the fiscal year here. And then there'll be another $160,000 that will be dispersed June 31st of 2025 to July 1st. Public Defender's Office was authorized, and I think these numbers might have changed a little bit because of some manpower issues, but the money that we authorized disbursement was $23,652 on April the 15th, and that carries in through June 31st. The follow-on money was $136,464, and that'll be authorized June 31st, 2025 through July 1st of 26. Chase Away Fentanyl, we authorized the expenditure of $14,754 on April the 15th, and then the follow-on money will be $70,822 that'll come out on June 31st for the follow-on fiscal year. And then recovery is the new high. We authorized disbursement of $62,250 on the 15th of April to be dispersed out through the end of this year, June 31st, and then $30,000 on June 31st through the July the 1st. And let's see, we have representatives here from Chase Away Fentanyl. We have representatives here from Recovery is the new high, and do we have somebody from the coalition? We have somebody here from the coalition, so, and one of the people on our committee here, Mr. Nettles, is familiar with the workings of the Public Defender's Office, and we've been briefed on that, and I think we'll get some follow-on information from.
I've got it.
Okay, you have it on you,
I
okay.
do.
So you wanna start?
I can.
Very good.
Mr. Nickel, I worked for the Public Defender's Office and worked for John Nickel, and he had a previous appointment he could not get away from, but he had sent me a text, and just to give you an idea, and I have looked, and so these monies have come in, and he was able to hire a full-time social worker. So he started with some statistics that began at April 15th, whenever she was hired, to date. And it says, when I looked today, we had 98 referrals for this quarter, 45 treatment placements, and 160 assessments that this social worker has already accomplished since April 15th. So he's going to take and get that. Matter of fact, we've got a copy of this letter. We're going to go ahead and get that in form, and then once I get that and get his exact numbers until June 31st, I'll get those emailed out to everybody on the board.
Very good. And, let's see, Will, you wanna tell us about,
Sure.
and by the way, we'll actually put, I appreciate you putting that in that template for us, and I'll go ahead and approve this.
Perfect, yes, sir.
All right? But go ahead and tell us what you've done with the money.
Yeah, so, it was kinda unexpected, the 2 extra months, so what we actually did
Yep.
was expedited our planning on that. We did get to collaborate with the Collaborative Coalition.
Yep.
They had already started a, mentorship football league, so we had, got to assist with the Super Bowl of that. We went around and visited, the county pools, here in Manchester and in, Tullahoma area, because that's where we're looking to host 2 events of our events to bring in our youth there, and then.
That's good,
also-
they get good crowds.
Yeah, well, we thought it would be a draw for
Yep.
the parents as well as the kids there to be able to utilize that, to kind of really get them in separate, one area, but then be able to target 2 different demographics there.
You have a specific age group and demographic that you're targeting?
Ours is just community as a
Global.
whole.
Yeah.
I know Mr. Nettles had raised a question in our presentation about what was our plan on targeting youth, right? So that is one way that we plan to really execute that, is to host 2 swim days, like I said, here in the Manchester area at the county pool, and then in Tullahoma's pool area.
Very good, very good. All right.
But that's kind of where we're at right now, is just, we bumped up our planning, because in our proposal, the first 3 months,
Yeah.
we're really just planning, executing, laying out things, and then really ready to move forward.
Okay, very good. I'll be happy to sign off on this.
Yes,
And we've got a representative here from Chaseway Fentanyl, Mr. Vickers.
Yes, sir. So our program that we're funding with this is called the New Start Program, and it's where we help people, that's on probation and got fines and fees. We help them. We ask them to come and support us and volunteer at our events, and things like that. We do naloxone training with them, and they help distribute the naloxone. And so part of the program is to develop a portal for them to report on, and we go through the probation departments and recovery courts.
Okay.
And so we haven't done anything with the probation department. I've had 1 referral from the recovery court, and I think I'm getting another one here real soon. So what we've done with the money so far is we have developed the portal, and we're setting on kicking off July the 1st, honestly.
Very good.
That's what we're looking at doing, and so, but we've got the portal developed and all of our guys, policy and procedures are in
Well, you had your
place.
event out there at the conference center that was well attended. I was very pleased with it.
Yeah, and so, and also, I mean, the committee knows that the 3 of us all collaborate on a lot of stuff, and so we're all planning, to try to have a big event here in Manchester or in Coffee County for sure, like maybe a recovery fest or something of that nature. And that'll be where we'll bring our, you know, our participants in and let them, work with us and surround them with a community of, people in long-term recovery.
So, since I've got all three of you here, I let you guys know, yesterday I was approached by some people about the establishment of a juvenile recovery court. So, stay tuned.
Be awesome.
All right. Yeah, I'm excited about that.
That's awesome.
You
That's
guys-
awesome.
Say you guys are too. All right. I know one of you. All right. Alan, you want to talk to us about the collaborative coalition?
Yes, we have not, well, I haven't seen any funds or anything to this point. I did have Mariana from accounting and budgets. She did reach out to me, she sent me an email, asking for tax ID number, that sort of stuff, and my assumption is that the collaborative coalition is to fall under the fiscal agent of the county,
Right.
and that's where I'm at.
Okay.
So,
Yeah.
we are in the process of, like, we had to apply for the assistant position.
I think we've got some interviews lined
Yes,
up
lined
tomorrow,
up
maybe?
for tomorrow,
Yeah.
and then hopefully, by July the first, we'll be able
All right.
to take off everything and be in place where it is.
So we're talking about hiring an assistant for a recovery court, and that's what he's talking about here. And we've got some candidates we're gonna be looking at tomorrow.
After this is over with, holler at me, because we had some similar issues, because our monies, the public defender's monies
Yeah.
goes through the state. And I was actually in Mariana's office and we talked about you, and I may have an idea of how you can get yours took care of, because your monies is gonna go through the county.
Yeah, Mayor,
It just has to create a separate line item.
Yes, sir.
And so we had talked about that, she and I had talked about that, but we may be able to get that, because you need to get monies coming in
Yes, sir.
sooner than later.
So we can get going, yes, sir,
Yeah.
absolutely, thank you for
Yeah.
that.
Would they need it, if it's operating under the auspices of the county, does he need a tax ID number, or does it
I would
just
not
run?
think so. I mean, unless it's, if it's not a 501c,
It's not.
I do not think you would need that, I'll be honest.
What did Mariana say?
So I
She
sent
thinks
her-
you need one?
I sent her the work plan and just told her what my assumption was of the plan, and my assumption still is that she's working on it and she's getting it taken care of.
Okay.
Yeah, so that's a big reason why, showing up today, just to see where we're at on that.
Very good. So, so that, I mean, that covers what we had on the agenda today, was, oversight on the expenditure of the money. What I'm gonna ask you guys to do is to, and Will's done a good job of this, is, put that in a memo for me, so that, and just explain where the money is, explain what you've done with it, and then I'll approve it, and we'll go ahead and keep it in the records here, all right? Let me ask you guys, as recipients of these funds, have you encountered any problems as far as accessing the funds? Well, other than what Alan's told me about with the tax ID issue, have you had any problems accessing the funds, or have you had any problems utilizing the funds? If so, let's talk about that now.
So I'll speak first. I mean, I actually received a call, I believe it was Miss Janice, if that sounds correct, that said, hey, I had a check, and that was unexpected of me, so
Okay.
I was like, okay. I guess my question though is that how the process going forward, July 1st will be?
Not to speak out of turn
Yeah,
here,
no,
but
he can
what
speak
I
to that.
understand is I know the state of Tennessee did a, let's just call it a bill, and it ran from April 15th to June 30th.
Yes, sir.
So then that invoice came in, it got paid out. So come July 1st, there'll be a second invoice
Right.
that come in. Now, that comes through the
follow-on
state,
funds
so
be
that
covered.
way she's got some sort of paperwork. But this paperwork here that the judge has probably will cover that, because it shows how it's broke down. And if she wrote you a check then, I'd say after the budget begins July 1st, your two monies probably will just have a check written out.
Yeah.
Yeah, I
Yeah.
would say
It'll
that
be
that's
the
how
same
that
thing.
would
You'll
work.
just get a check.
Yeah, no, that's fine.
Now, Mr. Burnett, I believe his money will probably have to work like the state money does, and it'll probably come through the county system, but it's, I don't know. I think I've got something in mind that I think that we can figure out how to make that
I
work.
think that's how we want it, so we don't have any
Right.
issues.
Right,
Yes.
yeah.
Well, yeah, we have some precedent for that, okay.
But yeah, other than that, no, everything went smoothly. Like I said, I was surprised to get the phone call.
If you don't, then take and call us and, cause what we can do is we can ask that question, and if they do require an invoice, we'll just text you back and say, hey, create something that looks similar to this, and, you know, accountants, I love them. I love numbers, because they, you know, you get a piece of paper, they want a piece of paper for their
Yeah.
file.
Yeah.
As long as that thing, your add, subtract, and it comes out right, they're happy and I'm happy, and,
As long as it comes
Yeah.
to zero.
right, yeah.
Well, let me ask you guys, since you've been engaged in, implementing the, object of the funds, do you see any need for additional fund? I mean, are there any projects that you could think of where these funds could be, you know, because it's gonna be a recurring process at least for a while. Can you think of anything that we need to think about going forward, that we need to think about setting funds aside for, any new uses, since you all have been underway since the 15th of April?
Not that I've been counting, no, sir.
I have a question. You talked about a juvenile recovery
Yes.
court? That would be a good place
Oh,
to.
yeah, oh, yeah, that's, I mean, this is just, this is obviously in its early stages, but, I feel like, you know, like I said, the recovery court, one of the uses of these funds is gonna be to hire an assistant, and I feel like when we interview an assistant, we probably need to tell them that, some oversight on that juvenile recovery court is probably in the works for part of their responsibilities, wouldn't you say?
Absolutely.
Yeah, I'm interested in getting that underway quickly.
I do think that right there is a good idea, that is for something that goes towards that, to
Yeah.
be able to help our youth who
Yeah.
is struggling with substance use.
Oh, yeah.
Yeah,
Yeah,
I've spoken with Judge Perry, I've spoken with Alan, we've kind of started this idea and kind of collaborated a little bit, just across the table. Got a lot of ideas, got a lot of great people in place. I've actually this is Dylan Haynes, he's my part-time employee. He actually was an intern from MTSU, and
Great.
he's the best student in the social work program at MTSU for the spring semester, so he's great. He's got a lot of good ideas, and he's done a lot of footwork and a lot of research.
Oh, good.
And got a lot of numbers to crunch for us. And, Judge Perry, we spoke with him, and, he's spoken with Judge Ewell. Kinda hard to get both of them together at the same time.
Uh-huh.
But we've spoken with Perry, and, he's fully in support. I've also reached out to Stephanie Etheridge of the Administrative Office of Courts, and she is gonna let me know soon if there's any funding that we might be able to access for that too, for this effort. But I see it as a collaboration
Yep.
between
Yep.
Alan and my office, and, you know, if we can do any in-kind contribution as far as staff, if we can, you know, help get this launched, I'm fine with dedicating service from our office toward it. I mean, as far as, you know, somebody that's already on the payroll.
You know, I don't do a lot with juvenile justice, but when I saw that email this morning, that got me thinking, what do they do with a person that's under the jurisdiction of juvenile court that's got a drug offense now? I mean, you know,
Well,
are there any special handling procedures?
we refer them out for alcohol and drug assessments immediately on their first offense.
Okay.
We also have some different, facilities that we can, you know, if the person qualifies and has the proper insurance, then, you know, we make that referral to that facility. They're so backlogged, that's the problem right now. A lot of these treatment facilities are backlogged, and the kids on waiting lists, you know, we try to send in them home services. The kids that are on probation through my office right now, they get that alcohol and drug assessment on the front end. We monitor, we drug test.
Y'all do that up there?
We do our own, yes, we just do the urine cup, but we do.
Y'all do the
test-
assessment up there in-house?
No, we refer those out to other agencies.
Typically, who would that be?
Solutions has been doing those. We also have some other, you know, Centerstone.
Yeah.
And I think done some. So I think it just depends on the case, really, everything's pretty much case
Well,
by case basis.
Could you or would it be appropriate to use these funds to make the assessment happen in your
That
thing, or
would be
would-
wonderful. I
Yeah,
just don't
yeah,
know
could
if
we
I
hire, could we
understand.
train somebody up or hire somebody?
it would make it move a lot faster.
I think so.
Already working on.
Yeah,
Okay.
he's getting certified to do that, so we can have that done
That-
in-house.
Good, that would be good.
And I mean, I don't know what that process would be, but if we had maybe a backup that way, if, when you're not.
I mean, I don't wanna load his plate too much,
Yeah.
and that can easily happen.
But if we divvy it up with,
I mean, like I said.
Right.
we-
Services
I
from
would like
yours,
to use one of my
that would
employees as
work.
an in-kind contribution, that way that would take some of the financial strain off. And I wasn't sure if this money is seed money, or if this is gonna be something recurring, I'm still
It's gonna be
kinda early.
recurring for a while, but it's got a kind of a sundown, you understand?
Yes.
Like, the funds will be substantial. I mean, this first round of disbursement, $480,000.
Yeah.
It's gonna, I mean, it'll stay high like that for a year or two, and then it'll tail off down. But I mean, we're looking at potential disbursements for years, but just not in the amounts we're getting now. It'll tail off,
Yeah.
especially, it'll tail off a good bit after next year.
or some of the funding goes to those folks that are doing the assessments for you.
Right.
That would take the burden off, because, a lot of kids have TennCare, but like, even the people.
Even
I'm
with
not
the
sure.
appropriate insurance,
They're
yeah.
backlogged, and it's just, there's not a lot of time to play around when you've got somebody with an addiction problem.
Yeah.
We want to get the
Yes.
services in as quick as we can, and unfortunately, that's just not always the case because of the insurance barrier. The financial aspect has always been a problem.
And very few of your people have private insurance, would be my guess. I mean, I don't wanna make judgments about
No,
people, but
but
that
you're
just,
correct. You're
All right.
correct. So that would be tremendous help if we could find a way to get those assessments by someone.
That would be
I don't know
great.
what the full training process is, but,
but if a person's under the jurisdiction of juvenile court and they get an alcohol and drug assessment and an inpatient rehab is warranted, I mean, what do you do there? Well,
that's what we're heading for, but right now.
I'm saying right
we do it, and they come out when the money runs out, when the insurance is gone.
so
they're
that could be
going
7
home.
days, 10 days, 2
They
weeks.
come home, and then unfortunately, I'm just gonna be quite honest, unfortunately, the turnaround is very short, and several of them go right back in. But most of the time, they're on a supervision through my office or the state, DCS probation. So there's somebody there to keep them accountable, but, it's in between sessions of rehab. And, and some kids come out and do fine, but, that's gonna be the minority. I hate to
Cumberland
say.
Heights has a youth program, and I used to have some familiarity with it, but most of those kids would stay there about 10, 15 days, seemed like. That didn't really seem
That's
like
not
long
long
enough to
enough.
me.
There are some facilities that will allow the child to stay anywhere from 45 to 90 days.
That's more like it.
During that time, they are able to get their schoolwork and that sort of stuff done. The great thing about recovery court is that whenever they leave from those facilities,
Yeah.
they will still have that more hands-on type of probation. So that,
Seeing somebody
a lot of
twice a
kids
week
that's
or
going
something
through
like
these
that.
things, they are used to people, leaving them and giving up on
Yeah.
them.
And it's
So
more follow-up.
with the program, they'll have somebody that really invests in them over a period of time, a long period of time.
I think
Yeah.
the biggest thing, and correct me if I'm wrong, but my experience working with youth in a clinical setting, and I hate to say this, but the systems built around them, there has to be quote unquote unsuccessful attempts at like a lower level of
Yep.
care, whether that's inpatient or not, in-house therapy, then to an outpatient setting before insurance would even.
So the
warrant
insurance company's gonna
insurance.
send everybody to intensive outpatient.
Yes.
Well, they're gonna start out probably sending somebody to that individual's house first, a couple days a week. And that's my experience, before it'll even bump it up to an outpatient style setting. And then from there, if that's unsuccessful, they'll send them to an inpatient.
So they're gonna push lower levels of care first before they
Correct.
get
Yes.
certified to go
Right.
inpatient.
Correct. So a recovery court kinda has that longer term accountability
Yeah.
piece, right?
Yeah,
We implemented what we refer to as juvenile recovery court in Macon County, just because of kind of we're seeing this over and over, right? And they wanted to do something, so we call it juvenile recovery court. What the judge does is he orders the juveniles to attend juvenile MRT, which is like an 18-week curriculum at first, and then they still have to do weekly check-ins as well. So they're getting evidence-based up front, and then we're even expanding that out to offer resources to the whole family setting, because we know that most situations, if the juvenile is having disturbances, it's probably something in the environment setting as well that needs to be addressed. So really, at that point, opening up for like family members to receive any kind of services.
So, talking to the members of the committee, y'all think that a juvenile recovery court would be an appropriate object for these funds disbursement?
Absolutely.
I mean, I think so.
Yeah.
I wouldn't imagine much pushback on that.
Well, it covers the whole spectrum. I mean, right now, we don't really have a lot to offer them.
I say we ask this question, how's drug court or the recovery court going?
I think it's going great.
Is it?
Yes, sir.
That's what we
going
need
slow.
to hear. I know it's going slow because in November, there was another allotment of money that went to the recovery court. And it wasn't part of this 4 different groups, but I back in November, I can see that it was there. So when I ask, I think what it finally gets to is it's going slow because there's rules that it's set up for them to be allowed to get into your system. So my statement.
There's a confining window.
Yes. My statement to the juvenile recovery court is let's find out what those rules are to be involved in that system. And if it's opened up big enough to allow you to be able to do what you're supposed to do, you could do it with the adults if we could get the people into your system to
Yeah.
work, right?
I feel like
I think me and you're on the same sheet of music here. I think the rules are a little bit too, or the rules are a little bit too confined to be able to allow you to be able to do what you need to do. On the adult side, we need to look at what the rules are going to be and what the court systems are going to allow us to do for the juveniles.
Juveniles, it should be a whole lot easier.
Do you
Yeah.
have-
I would
do you
think
have some
so, too.
input on that?
Yes, ma'am. So, my name once again is Dylan Haynes, MTSU. I've actually been working on this a whole lot. I've been doing stats from Quest, our Quest web-base that we have in juvenile court, looking at mental health, substance use, looking at individual disabilities, been looking at our race for referrals coming in. I've been looking at everything. I actually have a presentation for y'all if y'all have the time, just to kind of show you what I've already kind of got in place on what we're looking at the stats, as well as why this would be something that, I mean, some of you are already on board, but I just want to get you even more on board on why this would actually be beneficial to the community. Because I know one of the things that y'all said is, as part of the board, y'all want community safety. And this is really a preventative effort. I'm a probation officer as well with the youth service office.
Yeah, you do have to touch on prevention.
Yeah, it's a lot, and I hate seeing youth come in and then have to violate them all the time, and having to do this, doing that, and this program right here will be able to offer hope. The key word is hope for these youth. We want to offer hope to them. We want to help them, and I believe that this program.
When you say prevention, you mean getting at somebody before they ever
Yes.
come upon a radar or a Judge Perry?
Yes, sir.
I've seen over the years that I've worked with, youth, Franklin County Prevention Coalition, I've done juvenile MRT since 2010, 2011 over there. And I've seen over the years, just by being present and showing up for those individuals, every single day, every single week, the difference is made in their life. They have somebody that they can trust. If they're going through a hard time, they'll reach out to you. Still to this day, I've got probably 30-year-old kids, or adults now that went through the program, and if they're going through a hard spot, they reach out to me.
So do we have time to see Dylan's presentation? He's got some data for us.
20 minutes?
Yes, sir.
Oh, yeah, we got it.
Okay.
I have my computer with me.
It's needed. It is. Because these kids, from what I've seen around here, there's nothing.
Could you have
I'm
them
sorry,
look- Can you help him set up his computer for the presentation? Do you know how to do
He has
that?
a PowerPoint.
Sure.
Yeah, I mean, we set aside an hour, yeah.
Well, I really appreciate that, because we've been working behind the scenes on this for a few weeks, and I really appreciate the time.
Well, the timing of it, I got that email this morning, and I've been in court all day, and so I hadn't really had time to think about it, so I'm kinda glad you guys showed
Your
up,
last
you know.
name again, Dylan?
I am too.
Haynes, Haynes?
Yes, ma'am.
Okay. Are you master's level intern?
I'm actually bachelor's, but I
Okay.
am currently about to be going for my master's.
Awesome.
In the fall.
We're gonna keep doing as long as we can.
Yeah, sure.
Okay. Awesome. Yes, sir. Awesome. So once more, my name is Dylan Haynes. I work with the Coffee County Youth Services, and we are trying to implement a Coffee County Juvenile Recovery Court. And the main thing I want to say in all that is recovery. We do not want to say drug because drug is stigmatizing, so we're not going to even go for that. We're going for
Turn
recovery.
his
in what we're
microphone
doing.
on.
All right. So here will be our mission statement, what we really want. So the mission of the Coffee County Juvenile Recovery Court would be to improve public safety and the quality of life by reducing youth alcohol, substance use, and mental health challenges. I feel like we need to really address not only just one, but we really need to address all of those things. Through delinquency by providing this key word right here, a strength-based program. We don't want to be looking at deficits. We want to be looking at the things that can be really helpful to these youth. Through judicial leadership, through our judges, helping with judges, intensive court supervision, family support, as well as accountability. Our vision statement is to provide a safe environment that promotes healing and growth from the challenges faced by both the youth and their families. So here's what I have as really the project goals, what we're kind of looking at. We really want to reduce recidivism. We don't want to be seeing these youth coming back in and out and in and out and in and out. We really want to help and make sure that this program actually keeps them out. And that the way I want to do that is through quantitative data, which quantitative data is just simply data that's put in as numbers. So whenever they come in, seeing how many come in and are able to successfully complete the program, how many come in and maybe not so much, to be able to give that data back to y'all. Also, I really want to see increased communication between youth and family. Doing that through maybe something like a survey or something of that sorts. Really, the biggest thing that whenever we talked with Judge Perry as well as Alan Burnett is we didn't just want the youth to be the ones that are participating in it. We also want the families too. We want it to be a joint collaboration. And then finally, we want more pro-social behavior with youth engagement in the community. So we really want to see them being able to get back out there, be able to do the things in the community, whether it be a volunteer project, public service work. We want them to be able to keep their hands full so they don't have the time to be able to do the things that they're doing. So some of our project objectives. We really want to see fewer positive drug screens. We really want to be able to not see as many come through and actually have positive. We want to see lower. We want to see more successful completed plans. We want them to be able to come through this program and complete it successfully. We want, of course, more, again, pro-social behavior and community engagement. We want them to be able to give back to the community and be able to help. And finally, family outcomes and individual well-being of youth. We really want to be able to get that as well. Sorry, y'all, I love my presentations. So project overview. Once more, one of the things as I was doing, looking at the application for the opioid abatement money is community safety. That was one of the things that was really reiterated in the application. So community well-being and safety of Coffee County residents is a fundamental concern. So as a result, the suggestion being made of the opioid abatement community to reinstate a juvenile recovery court, which I'll explain that in just a minute. This program will be a collaboration between the judges, youth services, and the recovery court staff. And to say reinstate, so Judge Perry gave to us that in years previous, I don't know exactly what the years were, there was a youth drug court that they had previously before. And the way that Judge Perry talked about it is that he wanted it to be where we could just kind of base it off that. And I'll kind of talk a little bit more about that as well in the presentation. So once more, project activities, just the same exact thing over again. So expected outcomes and success measurements. So we really want to look at graduation completion. We want to see how many actually go through the program and complete it. And we want to look at recidivism rates. We want to see whether the youth that are coming in, whether they stay out of the trouble or they come back into it. So we really want to curate data on that. We want to look at making sure that most of the requirements for the program are completed. I wanted to start kind of low and then kind of see where we get from there. So I was looking at a 25 completion rate. And then, of course, increased awareness between youth and their family, better communication as well as accountability. Yeah. And then continued cooperation. Our biggest thing is continued cooperation between the judges, youth services, as well as the recovery court staff. All right, so here I'm going into my statistics. So this is all from the Quest web base. I'm going to say the time period was from January of last year up until June the 5th of this year. Looking at our referral rates, as you can tell, we've got a lot of different races. I mean, of course, whites kind of complete most of it, as you can see on the screen. Your whites are pretty much your biggest. But then you also see we are also serving other populations as well. We're serving some that we don't know their race, some that are Hispanic, some who are Asian, African American. So we have a large population that we're working with. So this being in and of itself, showing how many we have, shows you that it is very much needed. We've got a lot of kids that need help. And of course, if you have any questions, feel free to stop me. What we're wanting to do is we're really wanting to make this for ages, our target population would be ages 14 to 18. That is the way that it was in the previous drug recovery court, which now we're going to call the recovery court. And as you can tell, those age groups from 14 to 18, I mean 18 there's not a big one, but as you can tell from like at least 14 to like 17, that's where you're seeing a lot of referrals for those ages. 14 is 88, 15, 95, 16, 120, 17, 129, and then of course you got 18 as 1, but still you can tell that age group, there's very much a need for that kind of
What do you
program.
attribute to 18 to being 1? Is because they've reached
Yeah,
legal
because
Because they
Legal
went to
age.
adult, the
Yes,
adult
sir.
system.
Okay.
Yes, sir.
If you were counting 18-year-olds, that number would probably be higher than 129,
Yeah.
I guess.
Yes, sir. Then once more, really the status and misdemeanor offenses are our biggest ones that we're having, and this is where you're seeing alcohol as well as substance use. You're seeing all those in those two particular areas.
Was it mainly marijuana?
Yes, sir. That's what I've been seeing a lot with mine has been THC, primarily with vapes as well. And then, although it really isn't real big, it is kind of big, is the reoffending rates. How many people we're seeing actually go through and come back again, and then maybe come back again once, maybe come back again twice, maybe
That's
come back
actually,
again 3
compared
times.
to the number of adult probation violation warrants I signed, that's actually a pretty low
Yes.
number.
Yes, sir. But it's
Comparatively.
yeah, comparatively, but still, there's a lot of kids that come in and reoffend, and you're seeing that continuously through the numbers and everything. All right. Then for the next big part is really your mental health as well as your substance use. You're seeing that those really compose two of the bigger parts of the services that we're giving out. So you're seeing things like intensive in-home services. You're seeing things like mental health evaluations. You're seeing all these different things, and you're seeing that these two are biggest. And those are the two big things that we're trying to really work towards whenever we're trying to implement this juvenile recovery court, are those two things. Any questions?
What's the 15%?
The 15%, that's for the developmental disabilities.
Gotcha.
Yes, sir. And then as you can tell, this is looking at misdemeanor statuses. Although it may not be the biggest, because assault's really the biggest, it is close to being one of the biggest. It's the second biggest, would be the simple possession and exchange. So you're really seeing that that's a big thing that we're dealing with, is that. And then the others are just like speeding, violation of compulsory attendance law. So you're just seeing like all these different things that we're dealing with in our system. But my biggest thing with what we're trying to do with the money right now, or would want to do with the money if we're given it, would be to be really focusing on the things such as simple possession and casual exchange. So in conclusion, this program offers an opportunity to advocate for youth and their families. We really want to be able to provide them hope. It's based on an earlier model, based off of the model that we were given, and the model it's a 4-phase model, which I brought it with me, and I'll show you whenever I get done. There's an earlier model that we were given, and the model is a 4-phase program. And each program...
That's based on how the last iteration of it was set up?
Yes, sir. It was a 4-phase program that they went through, and you had to advance through each one. And this can really help promote collaboration between different organizations, leading to possible other future projects in the future. And this accomplishes the purpose of saving lives through prevention. And that is all I've got.
Thank you.
Yes, ma'am.
Yeah.
Very good.
Very good.
Thank you. Make sure I don't break anything. There we go. Thank you all again.
Yeah, I mean, who's gonna say no to that? I didn't have any, the last iteration of that juvenile drug court, or juvenile recovery court, I never had a client in it, and I didn't even know they had one, to tell you the truth, but I mean, how many clients did y'all have at your biggest? Do you know?
What, in our office,
Yeah.
in general, or just the drug
That were, would be considered, candidates for the drug court, recovery court.
For this now?
She had to guess.
Dylan did you run the numbers on that, as far as what we've got our caseload right now, that we break down the drug and alcohol charges? We can pull that up fairly easily, we just weren't quite ready for that today, but
Sure.
I would say that it touches at least half. If it's not.
I mean, based on that graph, yeah.
Charge, then it's a co-occurring thing, it's kind of like, truancy and tobacco are our two biggest,
That's half of
quantity
them right there,
offense.
isn't it? Pretty
And
much.
then that always comes up, I mean, we drug.
Right,
tests
if you're in
as
trouble for that, you're probably in trouble for that too,
Right,
right?
and they always seem to go hand in hand.
Oh,
And so
okay.
that's why we're hoping to do some prevention instead of trying to fix the problem after the fact, because, that it starts with truancy. And I think Ms. Brassfield would agree with that.
Yes.
We worked together on these cases for years and years, and, truancy, we run hundreds of truancy board cases a year, and a lot of those kids come right onto probation and immediately fail a drug screen.
Yeah.
So I think that there's a lot of red flags.
I mean, if they're skipping school, they're usually doing it to do, that was my experience.
That's exactly right.
The only thing I'd wanna see is to change the age range, like 12 to.
Well, yeah, I think middle school,
I think
sixth
because
grade.
14, you're missing the middle school population. You need to
Yeah.
include them.
Yes.
Yes, ma'am.
Yeah.
Well, and sadly, it even goes down to fifth
You're
grade.
right.
I mean, 4th and 5th grade is not unheard of.
Okay.
But middle school is
The
a
vapes
good place
are
to
mainly
start.
what we're finding on
Yeah.
that level, but where are they getting the THC vapes? I guess it's pretty easy to walk in a convenience store and get one, or send your big brother or sister or cousin or aunt or whoever.
Apparently, it's really easy.
I guess
Yeah,
anybody
it's
can
at
do it,
the
'cause
house.
obviously it's happening all the time.
Yep.
All right, well, thanks for y'all showing up. We really only expected to get oversight on the abatement funds, but, this is something that we would consider to be worthwhile and would be a good, candidate for future disbursement. Okay, so, we can make that happen. Does anybody have any closing comments?
Can I have just a question?
Sure.
We have not gotten to the point of a budget or anything like
Sure.
that, but when we do have time to sit down and process that with all agencies and everybody involved, do we need to plan on coming to the next meeting of this?
Well,
group, or-
It is, and
To stay tuned, my suggestion is that we reconvene. does anybody have any preference, but do you think we need to do it at the end of July, or can we go to end of August?
Well, at first it was set up to be done quarterly.
Yes,
I
what
mean,
I'm
so
saying.
I would
I'd
say run
say
it off 3
August.
months and, yeah.
August?
Okay, yeah. All right, let me suggest. Hang on just a second. My suggestion is that we adjourn this meeting and we reconvene on August the 27th unless somebody's got another, unless somebody's got a better, or unless somebody's got a real problem with the 27th of August.
I can't be there the 27th, it's my birthday.
How about the
I won't
20th?
be.
Okay, yeah, we
It's
wouldn't
your
want that.
birthday?
Yep, that is, I'm sorry, I have plans.
Don't change them.
How about the 20th?
I'll make a motion that we adjourn and set the next meeting
Very
date
good,
for
I
the
second.
20th.
Motion carries. All right. Well, I want to thank everybody for attending, and I want to thank public for showing up, and I want to thank you guys for the reports on the uses of the money. It's great. That's great. We'll help you as long as you do what you need to do. Very good.
Judge, I handed out a document that is a memorandum
Right.
of understanding that I did sign for the Public Defender's Office. I just felt like people in this committee needed to have a copy of that.
Yeah, this came up, but I had to go out of town. This came up right before I went out of town last week. Do I need to sign this as well?
I don't think so.
I don't think so. It's already, it's been approved.
Okay,
So
all right.
once you approved that it could be done.
Okay.
And then
Yeah,
you.
didn't
and
you
then
call me
I
about
did,
it?
I
Somebody
called
called
you.
me about it.
And then when you were gone, then the mayor signed it and.
Yeah, it's in the Public Defender's Office with my signature
It
on
is.
it. or
It's
has
already
been.
been stated, and I think the
Okay.
monies are already here.
Okay, that's good.
I had to make what I hope will be my last trip to New York City last week.
I did have one inquiry regarding our opioid abatement. A Rick Case beer,
I know, Rick.
you do? Okay, I probably could just, he was just inquiring what's the process and all of that, and I directed him to our website and calendar,
Yes.
hoping that he would show up here to ask his questions, but,
Can Rick sent that on my behalf. I'm Trish Luna, the founder of Lammy Learns. It's the children's program for families that have, for kids who have parents struggling with substance use disorder. So I have Lammy here. I work with a lot of, through the Tennessee Drug Endangered Children's efforts, the
Yeah.
TBI, Dangerous Drugs Task Force, also in the school systems. I know a couple of people in this room pretty well just from sharing this program. It's an intervention tool, but also a prevention program for kids from 3 to 12. So this is the set, which I'm happy to leave with you guys, that we were trying to figure out, is there a way? I know Dylan popped up with his presentation. I didn't know that was sort of the, how you present it, but I have the materials here, which I'd love to leave with you all, answer any questions that you have about it. We use a lot with law enforcement to have this as something they have as a first responder, if there's a child on a scene. This is it's the story and then a workbook that has reusable markers that can be used, and then this is the story. We also have an app, so it can be implemented completely free of charge, where you can listen to the story being read, share that with a child. Then there are programs on the app and free downloads of activity sheets to use with kids.
So Alan has been nice to share with some of the kiddos in Manchester City schools.
Right.
We've had that opportunity. After school is a great place for that to happen.
Absolutely.
Where did you say?
The after-school programming
Yeah.
is a really good
Yeah.
place for that to happen.
So I would just love to be able
to, have some resources spent right in Coffee County.
Sure.
For your residents in Manchester.
Sure.
So Rick was inquiring, what is the process? We did the general community funding, which we'll be finding out about soon. Apparently,
Right.
they had a meeting yesterday and
Right.
maybe made some announcements, but we haven't been notified. But I'm also just coming on a community level. I like to meet everyone in person. Here I am. This was my family's story. My children eventually, they lost their dad to an overdose, so I understand what this feels like to have this, as an issue. And my daughter now struggles, and my teenage grandchildren, who were 12 and 13, haven't seen their mom in about 5 years. So I know it's younger and younger that we have to have these conversations within a family in a safe and constructive way. So that's why I created it, and
Yeah,
I've
I
worked
mean,
with
this,
recovery courts and safe baby courts with DCS. And
I mean, that would be an appropriate organization for a dispersed fund. So what happens is, like the mayor said, on our county website, we'll put out appropriate time, just submit a proposal, and we have it, right now, it's an annual meeting. We disperse the money, and we generally have to cover it. So far, we've been able to cover everybody. So, yeah, I think that, yeah, I wish we'd known about it, you know.
me too.
Very
But
good.
that's what we're just trying to figure out. And Rick, if you know Rick, his wife is actually the illustrator of the book. And it's just me by myself. It's not, a huge organization.
Sure.
And so Rick was reaching out to every county to see what the process was. It's all different for all of the different counties. And, but I'm happy to leave this with you all, just to see it and explore, check out the website, and work on collecting data and trying to show the impact. The younger we are able to reach these kids. We actually just completed a 0 to 3 baby Lamey book that Kelly, again, was the illustrator, but this is for all of those 0 to 3 programs that teaching children from an early age about emotion regulation and emotional awareness sets up so we're not ending up here
Sure.
in recovery courts at 12 and 13, 14. So that's where we just try to get them younger and younger. I appreciate your all's work and time, and the work that you're doing is just amazing. So thank you.
And we appreciate you.
Yeah,
Thanks.
thank you. We're all on the
Thanks.
same team.
I wasn't aware of this program. I mean,
Yeah.
it's setting off a lot of bells and whistles in my head. All right.
I got one more email today from Trevor Henderson with the SMART initiative that sort of helped do our orientation. And he said, just checking in to make sure that all is well, and if you need anything from me regarding your settlement funds.
Great.
With
That's the fellow
thanks.
that came up here back last fall and talked to us about, yeah.
And I responded, I said, yes, everything is fine, I hope. There is a meeting of that committee this evening, thank you. So if you guys have anything, he's still willing and able to help us out.
All is fine, I hope.
Yeah.
That's good. I like that. All
We
right.
do have Alan involved, so I always have to throw in that default.
All right, and does anybody have any final comment? All right, then I move that we adjourn to the 20th of August. Very good. Thank you all. Thanks everybody for coming.